welcome. You're watching Health and Wellness Myths versus Fact about hormones. Now, hormones are integral to our body systems. They regulate a lot of what our body essentially does. Hormones are powerful. It takes only a tiny amount to cause a big change in cells and even the whole body. That's why too much or too little of a certain type of hormone can have very serious effects on your health. Men and women are quite different when it comes to hormones. However, hormonal imbalance is more common in women than it is in men. Women's reproductive health, fertility, menopause often involves the topic of hormones. So when female hormone imbalance comes to question, the consequences can actually manifest themselves throughout the human body, taking a toll on the woman's health and the quality of her life. There are some conditions that can be prevented by modifying one's lifestyle. Hormonal disorders can generally be managed well with proper medication and with treatment. We have an expert panel of endocrinologists who will provide accurate and actionable advice to prevent the development of hormonal disorders and guide you, the viewer, towards effective long-term management strategies. Joining us on the broadcast, Dr. Shivaprasad K S, Consultant Endocrinologist, Bangalore, Narayana Health City. We have Dr. Rajneesh Mittal, Endocrinologist and Diabetologist, Ex-Registrar PGI, Chandigarh, Mittal Maternity and Super Speciality Hospital, Yamunanagar, Haryana. We have Dr. Nilakshi Deka, Senior Consultant Endocrinologist, Apollo Hospitals, Guwahati. Thank you, doctors, very much for being with us. In general, hormones help to regulate many bodily responses such as appetite, sleep and growth. What really, Dr. Shivaprasad, if I can ask you, what really is the role of hormones when it comes to women's health?
Yeah, so hormones, they play a huge role in multiple aspects of women's health, starting from early childhood to the old age. To start with early childhood, it is important for growth and maturity of a girl into an adult female. And the second role is to have a regular menstrual cycle and to conceive a child. The hormones play a very important role. Here, estrogen, progesterone, the thyroid hormones have a role. The third aspect is the metabolic health. They have a role in controlling the blood sugar levels, the blood cholesterol levels, the hypertension, the blood pressure levels. So women who have imbalances in the hormones, they tend to have higher levels of blood sugar, they tend to develop diabetes, hypertension, and in the long run, they have a high risk of heart disease and stroke. Another important area is the bone strength. Hormones, they increase the bone strength in women, and women with hormone disorder tend to have fractures even with minor trauma. Last but not the least is the psychological well-being. Women who have hormone imbalances, they tend to have higher risk of anxiety, depression, and they perceive lower quality of life. So to say these are the major effects of the hormones in the body, but almost all organ systems in the body is affected by hormones to either directly or indirectly.
Right. Dr. Mittal, if I can come to you, hormonal balance is important for general health, but what are some of the common hormonal disorders in women that one should be aware of?
Yeah, I think the hormonal balance is very important for having a good mental and hormonal health of a woman. And most importantly, the PCOS is one disease, that is polycystic ovarian syndrome disease, which is very commonly seen in women of reproductive age group. Most of the times they present with acne, hirsutism, that is unwanted facial hair, or menstrual irregularities. They can present with infertility, and also eventually, as Dr. Shivaprasad also said, they can develop some metabolic disorders like diabetes, hypertension, and dyslipidemia. Another important hormonal disorder is thyroid dysfunction. There can be either a slow functioning of thyroid, that is under regulation of thyroid, probably that is hypothyroidism, or there may be over functioning of hyperthyroidism, that is hyperthyroidism, that is the thyroid is functioning more. Both of these can cause menstrual irregularities for the woman. Third is hirsutism, that is itself a spectrum where a woman can develop unwanted facial hair. The most common cause being PCOS, as I already mentioned, but also she can have hirsutisms can lead to androgen excess, which originate from either adrenal gland or ovaries. Then is premature ovarian insufficiency. This is another very important hormonal disorder that can be seen in women. Basically, the menopause comes after the age of 50, we say, or maybe after age of 40. But if some woman develops menopause or permanent cessation of menses occur before 40 years, it is called premature ovarian insufficiency. And then is last hormonal disorder that can happen is related to pituitary gland, which is our main master gland regulating all the hormones in the body. And a woman can develop menstrual irregularities related to diseases that can be because of either hypofunctioning of pituitary gland or hyperfunctioning of pituitary gland. Thank you.
Right, very interesting. Dr. Deka, let's come back to some of the fundamentals. What is the basic difference between male hormones and female hormones?
You see, most of the hormones, like my previous speakers have said, the hormones, they're same in males and females. However, it is the sex steroids or the sex hormones which are unique in males and unique in females, which makes the difference, the gender difference between a male and a female you have. The most important male hormones are androgens, which are also known as testosterone. The most important female hormones, on the other hand, are estrogen and progesterone. So, in fact, both males and females would have these hormones. That is, a female would also have androgens or testosterone. A male would also have some amount of estrogen. But it is the difference in levels which is responsible for the typical body contour, organ, reproductive function, which is different in both males and females. In males, the sex hormones are secreted from the testes, whereas in females, the sex hormones are secreted from the ovaries. And you also have certain other sources like adipose tissue, which can also synthesize certain sex hormones by converting other steroid hormones into sex steroids like estrogen.
Right. Dr. Shivaprasad, if I can come back to you at the moment, how does a woman know if she has a hormonal imbalance? How do you diagnose something like hormonal imbalance?
Yeah. So there are two ways a woman gets to know. Many of them, they present with symptoms, and some of them they get detected during a annual health check. Overall symptoms we can classify as general symptoms and reproductive symptoms. General symptoms are symptoms related to weight changes like excessive weight gain or weight loss, or skin changes like dry skin, hair loss, and mood changes. They can present with depression or anxiety. And another area is, again, I told you before, there is an increased risk of fractures. These are all general symptoms which are common in the general population even without a hormone condition. But the reproductive symptoms are usually typical of the hormonal condition. These reproductive symptoms are changes in the menstrual cycles, whether you're getting cycles very early or very late, or you're not getting cycles at all, and difficulty in getting pregnant and maintaining the pregnancy. And there are symptoms of excess testosterone in the form of facial hair or excess body hair, and increased risk of acne. When someone has these symptoms, either general symptoms or hormone-related symptoms, they should go and see an endocrinologist or a hormone doctor and get evaluated with simple blood tests. These tests help us to make a diagnosis, and as you told, there are easy treatments for most of the hormonal disorders.
Right. Dr. Mittal, speaking of the menstrual cycle, now this of course is a highly regulated physiological process that makes conception and pregnancy possible. What disturbances can occur due to hormonal imbalance in the menstrual cycle?
Right. See, if somebody's hormonal disbalance happens, or the axis basically to have normal cycles, especially from endocrine point of view, we need to understand that there is a basically connection between our superior most gland, that is hypothalamus, then pituitary gland, and then ovarian axis. If suppose all these three axes are in tune with each other, the cycles are normally regular. But if somebody has any problem related to this axis, they can develop some menstrual disturbances that we face. And women can present with symptoms like oligomenorrhea, Oligomenorrhea means when a woman presents to you when her cycles get delayed by around 10 to 15 days as compared to the normal days that she used to have menstruation regularly, or maybe her cycles are around less than 10 in a year. There we define that patient is having oligomenorrhea. She may have even amenorrhea. Amenorrhea is when there is a permanent cessation of cycles. She may not have cycles at all. So, and also they can have decreased bleeding, that is hypomenorrhea or hypermenorrhea, and sometimes menorrhagia. Menorrhagia is when bleeding once happens at a regular interval, but it gets prolonged for a multiple number of days. There are mainly when such women of reproductive age group present to us, we generally want to investigate most commonly for PCOS, thyroid disorders, and hyperprolactinemia. These three are the most common problems that we need to look at once patient presents with these menstrual irregularities. Thank you.
Right, Dr. Deka, speaking of recurring lower abdominal pain shortly before or during menstruation, now this is very common in girls and women. Why does this happen, and is it unavoidable?
In most of the cases, dysmenorrhea, which is pain in the lower abdomen, or you can be pain radiating to back, low backache, pain in the thighs. So these are symptoms of menstrual cramps or dysmenorrhea that we call. So many females would normally have dysmenorrhea. Okay, it is because of a lot of cytokines, prostaglandins. They are secreted by the uterus during the phase of menstruation, which can lead to rigorous contraction of the uterine muscles. As a result of this rigorous contraction, the blood vessels which supply blood to the uterus may be compromised as such, and so it can lead to ischemia or decreased blood flow, which can lead to that severe ischemic pain. It has also been compared to that of a heart attack or myocardial ischemia. So when the blood supply to the heart decreases, you get a pain in the heart. In the same way, as a result of these prostaglandins which are secreted by the uterus, they cause a lot of pain by causing ischemia and also by stimulating cramps in the uterus. Though this can be a phenomenon which actually marks that the cycles are ovulatory, in many a case, dysmenorrhea can actually reflect some underlying disorder. So dysmenorrhea is quite common in younger females, and it usually tends to decline with progression of the menstrual cycles. So after you have the first child, dysmenorrhea is usually said to resolve to a great extent. However, if a female harbors certain disease conditions like, say, endometriosis, which is growth of endometrium outside the uterus in various other organs or around the spaces in the pelvic area, or in certain conditions like adenomyosis, in conditions like uterine fibroids, or if there is pelvic inflammatory disease, that can aggravate or that can signify a pathological dysmenorrhea, where dysmenorrhea can be corrected if you treat these underlying conditions. One of the most easiest solutions that has been suggested to treat dysmenorrhea is resting during the period that you are having dysmenorrhea. Hot water fomentation or keeping a hot water bag in your lower abdomen or back can help relieving dysmenorrhea to a certain extent. As a part of lifestyle modification that you can undertake in order to relieve dysmenorrhea, it is maintaining a regular physical exercise, because it has been seen that athletes who exercise regularly, they tend to have less dysmenorrhea. Avoiding caffeine, avoiding alcohol, eating a lot of fruits, these can go a long way, and exercising regularly can go a long way in counteracting or treating dysmenorrhea.
Right, Doctor, thanks for that comprehensive understanding. We're going to slip into a very short break, but we'll continue our conversation on the other side. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Fact, and we're talking all about hormones. Dr. Shivaprasad, if I can come back to you at the moment, the absence of menses in a female of reproductive age is essentially related to the disturbance of various mechanisms in our body. What does this essentially do to your body?
Yeah, so as discussed, absence of cycles for a very long period is called amenorrhea. We consider a duration of more than 6 months as amenorrhea. This leads to many health-related issues. The first is the ability to get pregnant. It's very obvious if you don't have cycles, the pregnancy becomes difficult. The second is the psychological issues. This happens mainly in young women who compare their cycles with other women. So it can lead to mood changes and increased risk of psychological issues. And the third is the weight gain. When you don't have regular periods, you tend to gain more weight. And along with the weight comes many other problems like your diabetes, hypertension, heart-related issues, and stroke. The fourth is the risk of fractures. The fracture risk goes up because the bone tends to become weak when you don't have the regular cycles. And another important area is the risk of malignancy. If you don't have periods for a very long time, the risk of the uterine cancer goes up. So to reduce the risk of uterine cancer, you should have at least 6 to 7 cycles in a year. So these are the main problems with amenorrhea. As I told you, not having a cycles can affect almost everything in the body.
Right, very important perspective there. Thanks for that, Doctor. Dr. Mittal, what are the common causes of amenorrhea and how common is it?
Yeah, see, amenorrhea is quite commonly seen in our OPDs, and women present with cessation of menses quite commonly. Basically, as Dr. Shivaprasad also defined amenorrhea, amenorrhea is basically of two types that we need to understand when we try to discuss about the causes of amenorrhea. One is primary amenorrhea. Primary amenorrhea is amenorrhea where there is a cessation of, there is no onset of menses at all at the beginning itself. So when a girl was supposed to become mature, she fails to mature. That is called primary amenorrhea. Generally, we try to investigate such females at the age of 15 if they have not had any development of secondary sexual characteristics like breast development. But if they have some secondary sexual characteristics development, like some breast development is there, then we investigate them at the age of 15. So without breast, we investigate them at 13, and with breast, we investigate them at the age of 15. Then is secondary infertility, secondary amenorrhea. Secondary amenorrhea is basically a condition where there is a cessation of menses, either more than 3 months if the menses were regular for a woman, or 6 months if her cycles were off and on or they were already irregular. When we talk of causes and when we want to investigate the primary amenorrhea, especially, the most common cause for amenorrhea is Turner syndrome. Turner syndrome is a genetic syndrome, basically. It's by birth, and the female child fails to develop her cycle, and there are a lot other reproductive issues associated with that problem itself. Then is failure of development of structures like uterus itself, like Mullerian agenesis, we call it in our medical science or medical language. Then third is there could be, very importantly, physiological delay in puberty, that is called CDGP, like if both growth and puberty are delayed. So many female child do not get mature by the age of 15, but they are normal. They get mature at the age of 17 or 18. There is a delay in the maturity of their axis, that is HP axis. And then there could be hypopituitarism or GnRH deficiency that can cause primary amenorrhea. Then local cause, there could be imperforate hymen itself. Of course, it's not endocrine, but of course, one of the most important cause for primary amenorrhea. When we talk of secondary amenorrhea, most important thing, whenever a woman is coming with secondary amenorrhea, the first thing that has to be ruled out is pregnancy. It is the utmost important and mostly missed investigation, because many a times patient also fails to give history and thinks that she may not be pregnant. But we really need to look at pregnancy before we try to investigate further. Then later on, of course, she can have PCOS, as we discussed earlier also. Then POI, that is premature ovarian insufficiency, hypothalamic pituitary disorders like hypopituitarism and other under and over secretion of hormones as well. Another thing is there is something called hypothalamic amenorrhea. That amenorrhea is quite commonly seen in women who have sudden change in their lifestyle or stress. Like suppose somebody is having too much of stress, their cycles can get delayed or they may develop amenorrhea. There is sudden dietary changes. They have either lost weight quite aggressively or they have gained weight quite aggressively. Or there might be some change in exercise habits for them. If their exercise habits have changed, suddenly they start doing gymming, and athletes also, of course, sometimes with aggressive exercise can have delayed cycles. So these are the various aspects that can cause amenorrhea, which has to be taken into account by a very good history, and then should be evaluated depending upon the history and examination findings. Thank you.
Right. Dr. Deka, how long does it take to recover from amenorrhea?
Well, that's a question in which the answer would be different in different scenarios. If amenorrhea, say, is caused by some illness, like if it is primary amenorrhea, which is caused by, say, Turner syndrome or by premature ovarian insufficiency leading to just primary or secondary amenorrhea. In these cases, women or girls would require hormone replacement therapy up to the age of menopause in order to have their menstrual cycles. However, if it is secondary amenorrhea due to various causes like, say, PCOD, which is one of the most common conditions in today's time. In fact, that is also triggered to a certain extent by the obesity epidemic which we are having currently, because PCOD is both a disease of genes as well as environmental factors, and it is one of the most common causes of secondary amenorrhea in a girl, in an adolescent, in a young girl. All these are PCOD is one of the common causes. So in PCOD, it is lifestyle modification which plays a very important role in resumption of the menses which were not happening. So by lifestyle modification here, we would mean consuming a nutritious diet, avoiding stress, keeping an ideal body weight, exercising every day on a regular basis. All these would actually ensure a woman or a lady with PCOD to resume her normal menstrual cycles. If on the other hand, amenorrhea is caused by premature ovarian failure, which is a condition in which young girls who have just started their menses, they can actually have a depletion of the ovarian reserve. We know these periods or menstrual cycles are actually, these are highly sophisticated, well orchestrated hormone events which occur. They are orchestrated by the hypothalamus and the pituitary gland in our brain, which is there. And the hormones from these organs, hypothalamus and pituitary, they actually influence the ovaries which are located inside the abdomen to secrete these hormones on a cyclical basis. So any mild disruption in this entire process, which is orchestrated by the hypothalamus, pituitary and ovary, minute disruption can actually lead to irregular menstrual cycles, or it can actually stop the menses. So suppose a woman has primary ovarian failure, which is when your ovaries have dried up and they do not have enough reserve of follicles, ovarian follicles. In that case, menopause, which is expected to occur around 45 to 50 years of age, can actually happen even in a lady who is around 18 years or 20 years or even 15, 16 years. So in that case, these women would also require hormone replacement therapy up to the age of normal menopause. And if there are any other uterine causes, say there can be various physical causes like uterine adhesions or Asherman syndrome, which it is known as. In that case, certain manipulation by the obstetrician or the gynecian or the gynecologist can actually lead to resumption of the normal menses in these conditions. So local causes of the uterus, the cervix and the vaginal tract, that needs to be kept in mind. so that if amenorrhea is because of these causes which is there, it can be resolved by once the gynecologist takes appropriate measures to relieve the disease. And if it is caused by other causes like hormonal causes like PCOD or primary premature ovarian failure, in that case it would require hormone replacement therapy, lifestyle modification, avoidance of stress. All these factors are very important in resumption of menses. But the most important thing is that we should remember that menstrual cycles in females, because they are highly orchestrated events, even minute disturbances in their lifestyle, say periods of stress, emotional stress or physical stress, can lead to irregularities in the menstrual cycle.
That's all the time we have. Thank you all very much for joining us.